Hi, this is John Schumacher talking to you about the acute phase of an ankle sprain. So generally the first 3 to 5 days or so, depending on the severity of the injury. In the last video we talked a little bit about the Ottawa ankle rules. If you needed an x-ray or you needed to seek medical help, definitely do that first. But in general, from a rehab recovery standpoint, we start with a program called RICE, which stands for Rest, Ice, Compress, and Elevate. So the main thing, obviously we're going to be resting the leg. We're not going to have much of a choice if it's a significant injury. But we're also going to be starting a program of icing the ankle. I generally have my people ice their ankles for about 20 minutes on, and then what I'll have them do, after 20 minutes, take the ice off, wait till the skin temperature of the ankle is back to its normal, or it's going to be a little bit warm in this case, but normal skin temperature again, and then reapply the ice on and off throughout the day. They're also going to compress it if possible with a wrap or something of that sort, and then elevate it. Get it above your heart. You want the leg above your heart level to help drain out fluid and things like that that are in the injured ankle. After a few days, depending on the severity of the injury, again, you should definitely get it checked out before you partake in any program. Usually by day 2, 3, 4, depending on the level of the injury, we'll do a towel stretch just to start giving a little bit of range of motion into the ankle. The towel stretch is performed with the ankle up, wrapping a towel around the foot, and just simply lightly pulling it up towards you there. You get a little bit of stretch in the ankle and the calf. You shouldn't have too much pain with this. It should just be mainly a light stretch. I would start off very light. Don't be pulling hard to where you're getting any severe pain, especially on the outside of the ankle. We don't want to have any severe pain on the outside of the ankle. Very little pain. So be mindful of it. If it feels okay to do, you can start doing a little bit of stretching, like you say, a few days afterwards, but just to start getting it loosened up a little bit. But for the most part, it's a rest, it's an ice, it's a compress, and it's an elevate program for the first few days. So I'll see you at the next video.